Hello everyone, welcome to Dental Shots. I'm Dr. Mohanapriya. So this topic is on the checklist you have to look for while doing a denture insertion. So first thing you have to look is that whenever the denture is being got from the technician and from the lab, you have to check the tissue contacting surface, that is intaglio surface, with a own finger to find out whether any sharp nodules are present on the tissue contacting surface before even placing into the patient's mouth. Okay, if so, reduce it and smoothen it. Then coming to the flange extension, first we will see about the lingual flange followed by the buccal flange, what we have to look for. So the lingual flange just contacts the actual floor of the mouth. So it is a movable structures which is present, that is the floor of the mouth. So you have to be very careful on knowing the flange extension in the lingual flange. For that, you have to apply a pressure indicating paste on the edges of the lingual flange and ask the patient to touch the opposing buccal mucosa with his or her tongue. For example, if you want to check the left lingual flange, ask the patient to touch his or her tongue to the right buccal mucosa. Okay, if you are checking the right lingual flange, then you have to ask the patient to touch the tongue to the left buccal mucosa. Okay, so that it will give you an actual floor of the mouth extension so that the lingual flange can be trimmed accordingly. Okay, and coming to the buccal flange, we have to be very sure about the thickness of the buccal flange. If it is too much thicker, it will interfere in the coronoid process of the mandible. Hence, we have to ask the patient to do a lateral excursion of the mandible to see whether the buccal flange is too much interfering with the coronoid process. If so, we have to reduce it accordingly. And then coming to the frenal and muscle attachment, see to the frenal attachment and muscle attachment whether they are freely movable when the denture is in the mouth. So if not, we have to relieve that particular area where it is interfering with this frenal and muscle attachment. And hard palate and mylohyoid ridge has to be checked, that particular region, because mostly the pressure areas will be in that region. Patient returns back to you with an ulceration in these particular areas, so better look for it while you're doing a denture insertion. So in the hard palate, slightly apply your pressure indicating paste on the denture, and with your digital pressure put it in the patient's mouth and look for the pressure points. If the pressure points are evident, kindly reduce it. In the lingual the mylohyoid ridge also you have to look for in the mandibular denture with a digital pressure. Make sure don't put the upper and lower denture simultaneously and ask the patient to clench. That is wrong, totally wrong. So one by one you place the maxillary denture with your digital pressure, find out the pressure points, remove the maxillary denture and then place the mandibular denture. Look for the pressure points in the mylohyoid ridge, okay, with your digital pressure. So kindly do that separately, one by one. You should not place it simultaneously and ask the patient to clench. That is an important point you have to remember. Then check the maxillomandibular relationship in occlusion and also in centric relation, so that you can find out the premature contact in the centric relation position, and as well as ask the patient to do excursions. After you finish the CR position, the centric relation premature contact checklist, then you have to go with the excursion movements. Okay, and also you look for the horizontal overlap between the maxillary and mandibular teeth, because patient may come back post insertion tell you that they are suffering from cheek biting after the denture insertion. This occurs mainly because of the insufficient horizontal overlap between the maxillary and mandibular teeth, wherein the buccal mucosa is going and getting trapped between the facial surface of the mandibular teeth and the central aspect of the maxillary teeth. So to avoid this entrapment due to the insufficient horizontal overlap, if it occurs, you have to correct it by reducing the facial surface of the mandibular posterior teeth to solve the problem of cheek biting. So this is the overall view of checklist which you have to do during the insertion of denture. So if it is useful for you, kindly subscribe to Dental Shots. I hope you are enjoying the dental lectures so far which have been uploaded by me. So kindly subscribe to the channel. If you like the video, kindly click the like button, and have a great day. God bless you all. Thank you.